The next is about the Srotas. In the Srotas, again, the word Srotas would be having different meanings at different contexts. In basically, the Srotas has been derived as the Sravanat Srotamsi, a part of the body which produces some discharges also are called as Srotas. And that context is something different from the context which we discuss now. Now, and Srotomayayam Purusha, another of the definition which is present over there, is where it suggests about the cavities present in the body or the space in between the tissues also is called as Srotas. In this context, the Srotas has a different meaning which suggests about the channels, the openings also. Now, this has to be very clearly understood, like because the Srotas which are mentioned here, they may not be really following that meaning of the Sravanath Srotams where there is a discharge as such. These are just the openings which are seen over the surface of the body and maybe more or less related to the space in the body. And among them, the Srotas is considered as Bahirmukha Srotas here, and the Bahirmukha Srotas are Shravana, Nayana, Vadana, Grana, Guda, Metrani, Namasrotamsi, Naradam, Bahirmukhani. There are 9 openings of the body, and these 9 openings are that of the ears, eyes, and eyes also are considered as openings. Openings in the sense it's not that there is a real opening or cavity, but it gives you a access to the surroundings. That's it, how you receive the senses from the surroundings. Vadana, Grana, that mouth, Grana, and Guda Medra. These are considered as Namasrotas. Yasanyam Strinam Aparani Chatrini. Dve stanayoho adhastat raktavaham cha. In the females, the 3 more are there according to Sushruta, and those are the milk producing, that lacteal ducts in the breast, as well as the uterine opening, the vaginal opening also is considered as a Srotas. ननु अन्यान्यपि धमनी व्याकरणादेतानि श्रोतांशोक्तानि अहं बहिर्मुखानि इति धमनी व्याकरणाः उदितानि तु अन्तर्मुखानि. Now Dallana has justified these as the Bahirmukha Srotas and Dhamini etc. The other Srotas which we will be discussing later on related to the functions of the body, and the Sravanat, that which allows the flow as such, is considered as Antarmukha Srotas. In Indian philosophy, the body, human body, and the 9 openings, these are considered as one of the most closely related issues, and in almost every philosophical textbooks you will see the description of the human being as a human being having 9 openings. Namadwara are considered as the one quotation we have quoted here is from Bhagavad Gita. Sarvakarmani manasa sanyasasya sukamushi namadware pure dehi naiva kurvanna karayana. The point where are the exit points for the Atma. These Namadwaras also are considered as the exit points for the Atma life as such. So when a person dies, it is believed that it is conceived that the Atma will go out of the body through any of these openings of the choice depending upon the deeds done by the person and so on. So there are a lot of description about the 9 openings of the body in philosophy in different textbooks and different contexts. I will not go into all that detail. That's about one of the body contents. Then Shodasha Kandaraha, the Kandaras are 16. Kandara are defined as by the Dallana as Mahasnayaho, the thick muscular structure. Or in Vagbhata, the Kandara is defined again much better, rather more accurately. Tata Shakhasu Sandishuja Pratanvanti Mahasnaivani to Vrittani Tani Kandarasanyani. Vrittani, those which are spherical or cylindrical, the muscular structure which are having a cylindrical shape, they are considered as a Kandara according to Vagbhata. And of course, the types of the Snayu muscles classification, of course, we will come to that. According to Sushruta, there is a slight difference, whereas in Vagbhata, there is a slight difference in the nomenclature of these structures. And the muscles are classified as Sushira muscles and Prithu muscles. Sushira muscles which contain the cavity, which are covering the cavity, like that of the bladder or maybe the intestines. The smooth muscles of the intestines, they are called as Sushira or hollow structures, forming the hollow structures muscles. Pruthuni, the flat muscles are for Parshvaprushta Shirastu. This is what Bhagbhata has said. Now, anyway, there is a slight perceptual difference between the definition of Kandara in Kandara, Snayu, Peshi in Bhagbhata and Sushruta. We will follow at least, or we will understand that in a different sense, like unlike that of the definition of the muscles and tendons as we do now in the contemporary science. In the contemporary science, that description is based upon the microscopic structure, and hence there is always a difference of perception. Whereas Sushruta has considered these as the functional entities, the structures which give you the functional entities and which give a definite shape to the body. Now, those kandaras are which give that spherical or round globular shape to the body. They are considered as a 16 parts of the body would have that round muscular shape of the body, and those are Chasasra Padayoho, Tabatyaha Hasta Griva Prushtesho, Tatra Hastapalagatanam Kandaranam Nakhaha, Agraproloha. Those are the globular structures, that's the muscle structures. Instead of going into the individual named muscles as we do now, if you look at the group of muscles which give that prominence, the deltoid prominence of the shoulder, that's one, and the prominence in the bicep area, that's another one, and the another one would be the prominence in the flexor surface and the prominence in the palmar surface, muscular prominence in the palmar surface. These form the 4 of the upper limb and the 4 of the lower limb, and according to Sushruta, again there is a very beautiful description. Hastapalagatanam Kandaranam Nakhaha Agraproloha. Nakhas, the nails, they seem to be an extension of these muscular structures. If you do the dissection, you can see that exactly in the same manner. If you look at the extensor tendons, the tendons insertion over the phalangeal bone, it looks like the nails are integrated. So, by a gross appearance, without going into the microscopic details, by a gross appearance, this kind of a description is absolutely justified. Like when you do the dissection, if you have observed this, it looks like the nails are just the extension of the tendons, and that's exactly what's mentioned by Sushruta. Now, from the current perception point of view, it looks like a blur. Like if you say that nails are extension of the tendons, so you may just laugh at it. But that's not the point. The viewpoint is totally different. The present day's viewpoint is based upon the other issue, like the microscopic appearance and identifying the other tissue characters. Sushruta's study would be by looking at the morphology, the gross appearance as such. And for most of the practical issues, this gross anatomy is more than enough to study the body and maybe manage the situations, except in surgical practice. In surgical practice, of course, you do need the details of the anatomy further. Anyway, that's about the Kandara. So, Kandara, instead of saying as tendons or so on, equating to any of the current nomenclature, I would say that's the muscular prominences over the body, bulged group of muscles which give the prominence over the area. Now, the Griva Hridaya Nibandhinyanam Adhopagagatanam Medram, the other Kandaras are the spherical muscular structures which are present in the body. They are also present in the neck, Griva, and the thorax, and these are moving downwards towards the medra, penis. Now, if you look at the rectus muscle, without going into the current ideas, just look at the gross structure of the rectus muscle. It looks like the same. The rectus is extending into the pelvis, and the penile organ origin is almost related to the same, and that's how Sushruta has looked at the anatomy. So that Griva Hridaya Nibandhinyanam Adhopagagata, these muscular structures would end up in the penis, medra, and this is how Sushruta has identified the anatomy. And from the gross appearance point of view, this is exactly the same if you look at it. Of course, from the, as I told you earlier also, it's the same thing repeated. From the current anatomy point of view, you do not find such a relationship. You do not establish that kind of relationship. But the fact that if you look at the gross appearance, it looks seem to be justified as such. Similarly, The other kandara which is present is Shrudipusha Nibandhinanam Madhubhagatanam Bimbam. Now word bimba again is having different meaning at different contexts. In the context of our social samhita, the meaning of word bimba is Shronyasaha Prishta Nibandhinanam Prishta Nishtala Bandham Kurvatinam Prishajanam Chatasranam Adhobhagatanam Bimbam Mandalam Arthat Nitambasya Nitambaha iti Pataha Haranachandrastu Bimbaha iti Patitva Bimbaha Satchidram Trikasti Uchyate iti Vyakhyana. Now the word bimba is suggestive of the globular portion of the buttocks, the bulged portion of the buttocks. According to Haranachandra, bimba suggests about the Trikasti. Trikasti, the pelvic girdle, also is called as bimba according to Haranachandra. Now forget about that. If you look at the buttocks, that prominent areas of the buttocks, then and it has a continuity with the muscles of the back, the paraspinal muscles, the paraspinal musculature, and that continuity is exactly what's mentioned by Sushruta as the Shronaprishtha Nibandhinam Adhobhagatanam Kandara. And similarly, the same would be extending towards the superior side, showing that neck muscles, and you can see that bulging of the paraspinal muscles at the neck area, which gives the Murtha Urvaksha Amsa Pindadinamcha, which gives that connection to this. Now, if you look at this image and read that comments of Sushruta, it looks exactly the same without going into the correct details of naming these individual muscles. Of course, now you will have all that nomenclature of the different muscles, like, whereas without going into that, if you look at the gross appearance, it looks as if you consider the whole of these structures as a single entity without going into the details of that individual muscles. It looks like it's an extension of the buttocks. Similarly, if you look at the superior area, it gives like these muscles are extending into the neck and the patellar structures and holding on to that. So this is exactly how the anatomy is looked at by Sushruta. Then the next is Tasam Bahala Pelava Sthula Anu Prutu Vrutta Hrisva Dirga Asti Mrudush Lakshana Karkasha Bhavaha Sanjas Tisrasnai Pratyadakaha Yathapdesham Subhavata Eva Bhavanti Siranam Kandaranam Cha Medasak Kalakasya Gunaha Talat Parashleshma Bandhane Akshnoho Sirayutaha. Now all that Slera, Snayu, Kandaraka, particularly Snayu and Kandara, these names are named with the different names as such, are different nomenclatures. As I told you earlier, as you have referred earlier, the same shloka of Vagbhata, where the Snayu or Kandaras are classified as the Sushira or these Prathu as such. Now the muscles according to Sushruta, these are classified as Bahala, thin one, Pela, very thin one, Stula, thick one, Anu, very small, minute, Prithu, that's extensive, wide, Vrutta, circular, Hrisva, short, Dirga, long, Stira, firm, Mridu, soft, Slakshana, that's somewhat soft as such, Karkasha, rough surface. These are how it's classified. Now the method of classification now is something different, depending upon the appearance and then the microscopic structure as well as the gross structures and the direction of the muscle fibers. You classify the muscles as either circular as around the oral orbicularis oris muscles, convergent muscles as in the pectoral where the fibers they tend to be converging together, or fusiform where the muscle would have a bulged center and the two ends being somewhat thinner, or parallel muscles as, where the muscles fibers are parallel to each other, and unipinnate where the muscle would have one wing, or bipinnate or multipinnate, where that's where they will have two wings like or multiple wings. This is how it's classified. The basic idea of identification of these muscles based upon the shape is the same. The only difference comes in when it comes to the details. Now you have different nomenclature and different sort of details. And what Sushruta has said also is from the singular view, the details are different. There is virtually not much of a difference in the context as such. It's only about the nomenclature and how you look at it as such. Now, Mansasirasnai Astijalani Pratekam Chatvari Tani Manibanda Gurpa Samshitani परस्पर निबद्धानि परस्पर गवाक्षितानि चेति ये हि गवाक्षितम् इदं शरीरं. The relationship between the muscles, blood vessels and the tendons and bones, these are very close to each other, and they would be forming the different structures of the body in such a way that the body would have sufficient space, as well as there is a space for the movement. The whole body has the spaces. Gavakshitam is having the space as such. Now that Gavakshita, the word is commented by Dhalana as a Gavakshitam iti Virachita Nirantara Jala Kaka Randhra Nikara Parikalitam ityartaha. Where there are sufficient space and movement for the movement and the of course freedom of the structures to grow. Now these again are considered as four in the body. That's Manibandha in the wrist joint area, Gulfa ankle joint area. These are considered to the most prominent areas of the body where there is a complex structures of these ligaments, tendons and muscles, which allows for a very specific movement, that wide range of movement, and the structures are complex. Now it's absolutely justified. If you look at the ankle and the wrist joint area, the structure is so complex. You have that carpal bones as well as the tarsal bones, which would make the structure very complex, and 7 of them, and bound together by very small tendons and ligaments. Now of course you have all that nomenclatures, I will not go into that. And the direction of the ligaments, now maximum number of ligaments are seen in the around the wrist joint, and that nomenclature of each of these ligament itself is a very crucial issue. And then you have muscles, which gives that complex range of the movements which are not seen in any other joints. And though it looks like unstable, now these small pieces of the bones which are merged together, it gives a basic instability from the appearance itself, but still that joint is quite stable and the joint is having that maximum range of movement. And that's why these are considered as the Mansa Sirasnaya Asti Jala or Sirasnaya Asti Jala. So is the case with the ankle joint. Now ankle also is the same thing, where you will have that complex tarsal bones which are connected to each other by complex ligaments, in a very large number of ligaments, and then of course the muscles, which gives that wide scope as well as stability to the joint. Now ankle joint is the one which carries the maximum weight of the body, and also is under movement for the maximum duration. Maximum movement also are seen in that area, and that complexity is produced by these a large number of bones and large number of ligaments, and that's why they are called as astijala. Then the next is about the kurcha. Kurcha is again, word meaning of kurcha is something like a brush. So something which gives an appearance of a brush. When you dissect the body and look at the structures, there are some structures which give that appearance of the brushes. Now I will not translate kurcha as a tendon or ligament or muscle. I am just suggesting about the appearances of the structures which look like a brush, and those are Hastagriva made ratio in the palmar area, plantar area, and the mid penis area, and griva, neck area. Now these hastayoho do, padayoho do, griva medrayoho ekekaha. If you look at the hand, the dissect the hands, the palmar fascia, it exactly looks like the brush, the typical, and the plantar fascia also is the same brush-like appearance. If you look at the pelvic girdle, when you do the dissection of the pelvic girdle, that the oblique muscles of the abdomen merging with the penile musculature, the pelvic floor, that gives the same appearance like the kurcha. Now I am not going into the nomenclature of the structures as per the current anatomy. That's not the point. If I go into that, you will have a lot of confusion. So I will not go into that part. If you look at the image, and if you look at that relationship between the penile muscles and the corpus muscles as well as the pelvic floor area, it gives an appearance of the brush-like, and that's what exactly Sushil has mentioned as the kurcha. Similarly, in the neck, the platysma muscular structure which gives that support to the neck, If you look at the area from the anterior or maybe the posterior side, both of them would give the same brush-like appearance, and that's exactly what's considered as kurcha. So, on that point, what I'm again repeating, stressing would be, we will not name these structures according to the current nomenclature. We will just look at the appearance as you dissect the body, and these details of the current nomenclature, they are kept apart. And when we identify these Ayurvedic nomenclatures and Ayurvedic structures, we have to look at it as an integral component of what we perceive at the first appearance. That's the point. Similarly, the next is Mamsarajavaha. Mahatyo Mamsarajavaha Chadasraha Prishtavam Vayataha Peshi Nibandhanartham Dve Baho Abhyantare Dve. Mamsarajju. Rajju is a rope-like structure, a long muscles which give that rope-like appearance and give the strength to the body, and they are supposed to be Peshi Nibandhanartham. They are supposed to connect to the Peshi, the muscular structure. Peshi is a Pishita Bhaga, that where you have the fleshy portion, and that the areas other than the fleshy portion which give that binding, that's the long tendonous structures, they are the considered as Mamsarajju. If you look at the deep group of the paraspinal muscles, the superficial group of the paraspinal muscles are fleshy throughout. But if you go into the deep group of the paraspinal muscles, you have a long tendinous area, the spinalis muscles, and of course now we may name it as a longissimus and the spinalis muscles, paraspinal muscles together. That gives you that appearance of a rope-like appearance, the tendinous portions of that, and in the lower area it becomes the same iliopsoas, as such the iliacus and the psoas muscles bind together. You will have a rope-like tendinous area on the paraspinal area. That's exactly the Mamsarajju over the area. Similarly, over the shoulder, if you look at the triceps area, triceps tendon, the biceps and triceps tendon, the superficial groups of the superficial fleshy portions of the triceps are dissected out, then you can see that tendinous area, and that's exactly what Sushil has mentioned as the Mamsarajju of the arm. Then Sevanyaha, Sapta Sevanyaha. Sevani, the word Sevani is meaning suture, and the appearance of suture-like structures over the Shirasi Vibhaktaha Panja, 5 suture lines of the skull. Now exactly the same word is used. Suture lines are the words which are used in the current nomenclature, and it's well known over the skull bone, the shape of the suture lines and the fontanelle at the time of the birth, and then during the adult life they are quite detailed in the anatomy. Now the numbers are almost the same, like you have that 5, the sagittal sutures, and then the coronal sutures, and then of course the posterior sutures. That's how it has to be. So that 5 suture lines of the skull. Then jihva shape seho ekaikah taha parihartavyaha shastrena. At the jihva, at the tongue, base of the tongue, the frenum, linguae, sublingual frenum are in the perineal raphe, the midline, the suture line like in the perineum. Of course, from the development, embryological development point of view, these have a significance which suggests about the lines of fusion of the epidermal tissues over the body. But of course, from the surgical point of view, that may not have that kind of significance as mentioned by Sushruta about the frenum and the perineal raphe, except for the fact that the perineal raphe is less vascular, and hence any injury, any incision made at the perineal raphe would not heal as elsewhere. So time taken for healing would be more. Frenum, of course, there is not much of a very sensitive structure, it can be cut as such, but Sushruta has considered them as surgically sensitive areas. Of course, skull, sutures of the skull, they are surgically sensitive, no question about that. Frenum linguae, now from the current anatomy point of view, doesn't have much of a significance from the point of view of that surgical significance or complex structures are there, are not there. Perineal raphe is only from point of that it's a relatively less vascular area, and hence it may not heal well. That's how the applied anatomy act point. But Sushruta has considered them as surgically sensitive areas, and we should not cut those tissues during surgery. Then Chaturdasha Astham Sanghataha Tesham Trayo Gulpa Janu Angshaneshu Yetena Itara Saktibahu Cha Vyakyato Trika Shirasoho Ekaikaha. Asti Sanghata is where multiple bones are fused together. Number of bones could be more than 2 or 3, and that complex combination of the bone gives you that structure. See, now the present point of view, when you study the anatomy, you will study these individual anatomy, like carpal bones, each of the carpal bones, tarsal bones, each of them. When you study the pelvic girdle, you study these pelvic bones separately. But if you look at the integral structures of the body, they look like a single unit. So when multiple bones are functioning like a single unit, that's considered as Asti Sanghata. And according to what Sushruta has said is, the numbers of them are 14 in the body, and those are Trayaha, Gulfa, Janu, Vankshane. So in the Gulfa ankle area, and in the knee joint area, and the inguinal area, the hip joint, where again you have that multiple bones forming that complex structures. Though in the hip it's only the 2 bones, whereas in the ankle and knee you have that multiple bones. And along with that, Trika Shirasaha, pelvic girdle and the skull. Of course, very obviously the skull bones, the bones of the skull, they produce that complex appearance, as well as the your ankle and wrist joints, they produce a very complex combination of the bones, and these are very essential to study the integral structures of the body than really studying the single bones as such. Then Chaturdesheva Simantaha, Teja Asti Sangatavas Varnaniyaha, Yatah Te Yuktaha Asti Sangataha, Ehi Yuktaha Sangataha, Te Khalu Astadesha Ekesha. Now, Simanta are the hair lines seen over the body. Simantaha, the divisions, the word meaning of Simanta in Sanskrit literature is something which gives you the demarcation. This is related to the hair lines, the lines of the hairs which give that direction to the body, and according to Sushruta, they are 14, and they are related to the Asti Sanghata near the wrist elbow. Of course, from the practical clinical point of view, there are no such obvious description of such hair lines in the body in these areas. Now we limit the hair lines to the whatever when we study the hair lines from the surface anatomy point of view. It's about the skull, the face area, and of course in the genital area. These are considered as the hair lines where something is related to the physiology. Otherwise, there are no such descriptions in the current anatomy. But from Sushruta's point of view, this appearance of the hair lines, the direction of the hair lines changing over the area, and the folds of the skin which are seen over the area, that gives you an idea about the scope of the movement of the joints, and any abnormalities of the joint movement can be studied by looking at the shape of these, and that's why they are considered as important, and they are counted as a 14 related to the same Asti Sanghata, the same areas where you have a fusion of the bones. Then comes the question of the number of bones as such. Trini Sashastini Asti Shalyani, Asti Satani, 363 Sashastini 363 bones are described Vedavadino Bhashante. Shalyatantreshu Trinyama Shatani. According to Sushruta, that Ayurvedic point of view, there are only 300 bones. 363 are counted in the Vedic literature, and in Sushruta, the numbers of the bones are counted as 300. Samancham Astisharam Shakasu, that's 120 bones are considered to be in the limbs. Saptadashottaram Shatam Shoni Pasha Pristogarasu, Saptadashottaram Shatam, 117 bones are counted in the pelvic and the lumbar area, the spine, maybe the torso of the body. Grivan Patyurdam Trishasti, 63 above the neck, Evamastan Trinishatani Puriyate, 300 bones are counted. Now, from the current point of view, anatomy point of view, the number of bones or identified bone entities in fetus and adults are different. In the fetus, because the growth centers are multiple, the numbers of bones counted are 300, and in adult it comes to the 206, and the numbers almost are similar. Of course, there is no question of or maybe trying to justify this variation in the numbers. According to Sushruta, the teeth also are classified as the bones, and harder cartilages also are considered as asti. Teeth are considered as asti, as well as The harder cartilages also are called as asti, and hence there will be a difference of counting, the way you count it. And now when we counted the bones, the perception is different. So I think that numbers are not a very significant issue of difference of opinion. But the point is, every structure of the body was keenly observed and documented. Now, this again is about the same numbers in detail. Ekekasyaam padangulyam trini tani panchadasha. In each of the foot and the palm, there are 15 of the bones. Talakurcha gulpasti samskritani dasha. In the talakurcha gulpa, in the wrist joint area or the ankle joint area, there are 10. Of course, now carpal and tarsal bones, the numbers are different. In the carpal, you have 7 bones as such. Pashnyam ekam, in the Pashni 1, Janghayam 2, in the Jangha portion, that's the leg portion, 2 tibia and fibula. Janani ekam, the femur, ekam uru, in the uru again the femur portion, the upper portion. Trimshat evam ekasmin sakti bhavanti, in the limb there are 30. Of course, we will not go into that equating these numbers. Now, if you count the numbers as per the current anatomy, you may not get to the same number. So, we will not go into that part. Eten itarasakti bahucha vyakhyata. Shroonyam pancha 5 bones in the pelvic girdle. Tesham gudabhaga nitambeshu chatvari, in the gudabhaga nitamba area. That's the posterior portion. 4 of them. The trikasamsitam ekam. Maybe some people equate it to the sacral and coccygeal bones. I think it's not really necessary to go into that part. Then parshve shatrimshad ekasmin dvitiye api evam prishte trimshad. The parshvagata bones are maybe the vertebral bodies, and Sushruta had considered these vertebral bodies, the components of the vertebral bodies, like the lamina as the 2 entities. So hence, on one side shatrimshad 36 and other side again 36. Dvitiya api evam prishte trimshad. The vertebral bodies are trimshad. 30 as Ashta Urasi, 8 are in the thoracic area, Dve Amsapalake, the scapular blades, Grivayam now, in the neck again the vertebral bodies are now 9 in number according to Sushruta. Now the numbers are different. Nomenclature of the thoracic, cervical or lumbar vertebral body, sacral vertebral body, that nomenclature is based upon the criteria which is totally different from what Sushruta has considered. Hence, you may not have that bridging, the equating the numbers as such. So we will just casually look at it. Kantanadyam chatvari, in the cartilages of the larynx, they are considered as asti by Sushruta, whereas now we consider them as cartilages, not the bones. And there are 4. Dve hanuho, in the hanu there are 2. Dantaha dvatrimshad 32 teeth also are considered as asti. Nasayam 3, the nasa, nasal bones and cartilages of the nose also are counted as the asti, whereas now we have that nasal only vomer bone as the single bone, and then the nasal cartilages, the other portion are considered as the cartilages. Ekam taluni gandakarna shrinkeshu ekekam shat sirasi iti etani panchavidhani bhavanti. Now these numbers of the bones, again more important is this. The types of the bones are considered as a Kapala, Ruchaka, Taruna, Balaya, Nalakasamyani. Tesham, Janu, Nitam, Amsa, Gandatalu, Shankha, Shiras, Kapalani. Kapalasti are the flat bones which are present over the skull or in the pelvic area as such. And Dashanastu, Ruchakani. Ruchakasti are the Dashana. The teeth are considered as a Ruchakasti, which is not at all to be seen in the current nomenclature. Grana Karnakshi Kosheshu Tarunani. The Tarunasti cartilaginous portions are like the Grana Karna, etc. Then that's exactly the difference of opinion, or when it comes to the question of perceptual differences. These are the issues. Tarunasti are considered as asti by Sushruta, whereas now we consider the cartilages as a different entity than that of the bones. Parshvapushta urasu valayani, valayasti, circular bones as such, and Sheshani nalakasamyani, long bones. Now, in the present day situation, again we classify the bones as per their shape as long bones, short bones, flat bones, sesamoid, irregular, depending upon their shape and the functions also. And the other perceptual difference, like cartilages, teeth being considered as non-bone structures, is the other issue. Hence, there is no question of bridging these issues. Like then, bhavanti chatra आभ्यन्तरगतैः सारैः यथा तिष्ठन्ति पूर्वहाः अस्ति सारैः तथा देहः ध्रियन्ते देहिनां ध्रुवं तस्मात् चिरविनस्तेषु तं मांसेषु शरीरिणाम् अस्तीनि न विनश्यन्ति साराणि यथानि देहिनां मांसानि अत्र निबद्धानि शिराभिः स्नायुभिस्तथा अस्तीनि आलम्बनं कृत्वा न शीर्यन्ते पतन्ति वा. The asthi are the strong structures of the body which give that shape and stability, whereas all the other soft structures like the muscles and the tendons are inserted over them and they have relatively shorter life, whereas the asthi would have a longer life and gives the structure, entity, strength of the body. Core strength of body is depending upon the asthi, and that's why called as astisara. Then the next is sandhi. Sandhayastu dividaha chestavantaha sthirascha शाखासु हनुमोः कट्यां चेष्टावन्तस्तु सन्धयः शेषस्तु सन्धयः सर्वे विज्ञायाः स्थिराः बुधेः. Sandhis, the joints of the body, are categorized into two categories primarily: the sthira, immobile or immovable, and the movable, or which have a range of movements, and they are considered again as in the shakha, in the limbs, and hanu or the mandibular joints, kati in the pelvic area. These are the joints given as example of chestarandha, which is movable, and the less movable are sheshas, the sthiraha, which do not have the movement. Then their numbers again, sankhyaprastu dashottare dveshyate, 212 types of numbers of joints are counted by Sushruta. Again, in the current science, you may not have the same number. The number would be different because the perception of that concept of a joint is totally different. So we'll just casually look at the numbers. Shakasu Ashtashashti, in the Shaka there are 68, Ekonashashti Kosta in the Kosta area, abdominal area 61, Grivam Patyurgam Trashidi 33 over the neck, above the neck, Ekakasam Padangulyam Traha in each of the fingers, phalangeal bones, there are 3 joints according to Sushruta. Now, when you count the joints over the fingers, the thumb would have lesser number of the joint, whereas others, metaphalangeals and the phalangeal areas, others, they would have 3. So, there is a difference of perception. एवं सप्तदशैकस्मिन् सत्ते भवन्ति एतेन इतरशक्तिबाहु च व्याख्यातौ त्रयः कटिकपालेषु. In the कटिकपाल, that's in the pelvic girdle, there are 3. Chaturvimshati Krishnamshe, 24 are in the vertebral column. Again, the number may not be same as you count now. The number will be different there again. Tavanteva Parshvayoho, similarly on the Parshva sides. Urasi Asto, over the chest area there are 8. Tavanteva Grivayam, in the neck again the same 8. Now, the same issue as I referred to, that this delimiting that cervical, thoracic and sacral area, lumbar and sacral zones of the vertebral body, that concept is different from what Sushruta has mentioned and what we see now. Trayat kante nadishu hridaya kloma nibaddhasu ashtadasha. In the hridaya also a sandhi, a joint is described by Sushruta. Now, which is that hridayagata sandhi or hridaya, whether you have to count, consider this as a heart or the total thoracic area, and which is that exactly the joint which is mentioned by Sushruta as a hridayagata sandhi or kloma, the soft structures like maybe your pancreas or so on. Whether which of those joints there, it's quite difficult to make out from the current point of view. Danta parimanaha dantamuleshu, the joints of the dantamula are exactly the same number as that of the teeth. Ekam kakalake. Kakalaka is again the forehead. In the forehead, that is considered to be 1. Nasayam, in the nose also 1 joint is suggested. Dve vartnamandalayoho netrashvayoho gandakarna shankeshu ekekah dvau hanusanti dvau uparistad bhruvoho shankayoscha pancha shirakapaleshu ekah murtni. Attempting to identify these with the current nomenclature is practically not necessary. So I will just leave it as such. But the important other part is the classification of these sandhis, joints. The classification would be Kora, Ulukhala, Samugga, Pratara, Tunasevani, Vayasatunda, Mandala, Shankhavartaha. Depending upon the shape of the joints, they are classified as Korasandhi. Korasandhi are Tesham, Anguli, Manibandha, Gulpa, Jan, Kurpareshu, Koraha, somewhat flat joints. And in the hands and in the wrist area, the classification of the joints in the current method is slightly in the similar manner, but there is a slight difference in the perception. I will come to that part. Sandeha, then Kaksha Bangshana Dashaneshu Ulukhala word meaning is the instrument used to the pound the rice or so on. That kind of fish is ulukhala, something like the ball and socket or socket like deep socket like joints, not ball and socket, deep socket like structures. And Sushila has mentioned Kaksha Vamshana, the hip, shoulder, and the teeth as the ulukhala. Amsapita Guda Nizambeshu Samudgaha. Samudgaha is somewhat hinge joints like Amsapita Guda Bhada Nizambeshu. Griva Pushamsho Prataraha. Prataraha widespread joints like fibrinous joints, like Griva Pushamsho, the paraspinal joints as such. Shirak Kati Kapareshu Tunasevani, Tunasevani, where you have that suture line like appearance which forms the joint. Hanuho based Vasatundaha. Vasatundaha, again, in the current nomenclature, they are named as ball and socket, but as in case of the maxillomandibular joint, where there is a deep neck-like prominence, that's the Vyasatunda, which is compared to the beak of the crows. Kandasude Netra Klomanadish Mandalaha, Mandalaha circular joints, then Shankhavartaha, that's a somewhat spherical shape. These are the types of joints as mentioned by Sushta. Current nomenclature of the joint is based again on the shape, but the nomenclature is slightly different, and they are the pivot joints as in case of the neck, where you have a circular movement, and ball and socket joints, the names are because of the shape of that. Hinge joints as in case of the elbow, or in the knee also it's the same hinge joint as such. Then ellipsoidal joints, where you have some oblique movements as in case of the wrist. This is how it's classified now. Our saddle joint, which also has some flexion and extension movement. And of course, basically the joints are classified into three categories instead of two, as mentioned by Sushruta, like Stira and Chala. Now we classify them into freely movable or non-movable or fixed joints, as well as semi-movable, or diarthrosis, amphiarthrosis, or synarthrosis, and these are again classified based upon their shapes as such. Now, there is virtually not much of a significant difference in these descriptions. The nomenclature and the way you look at it is slightly different, and hence there could be a slight difference in the number and the virtue of looking at the issue. But otherwise, there is a absolute fusion of the ideology as such. Asnam tu sandeyo hite kevala parikirtiraha peshi snaishiranam tu sandhi sankhyanam vidyate. The numbers of the bones and the joints are counted, whereas for the muscles and the tendons and vessels, there is no question of giving the numbers as such. There is no question of specifying the numbers. Still, Sushruta says like there are the numbers of the snayus, and those snayus are considered as a namasnaya shatani. There are 900 muscular structures of the body. Now again, in the current nomenclature, you cannot have the same numbers. So going into that again would be a waste of time, I think. So we will keep it as such. We will just casually look at it, what Sushruta has considered. The numbers of the muscles which could be counted by Sushruta during his method of dissection, and the way he looks at it is something different. Snayu are considered as the thicker structures of the muscles which cover the body, and they are tasam shakasu kshatshatani, 600 muscles in the 600 snayus. I would not again use the word muscle. Snayus, because snayu is not muscle alone. That's the point. Dveshate trinshat coste, 230 in the costa, in the abdominal area. Grivam pratyurdhvam, over the neck it's up to the 70. Ekekasyam padangulyam shan nichitaraha trimshad, 30 in each of the foot and the hands as such. तावदेव तलपूर्तिगुल्फेषु 30 in the palm and the wrist and ankle area. तावदेव जङ्घायां in the jangha again 30 दशजाम्नि in the Jana Pradesh, that's the upper portion of the leg. There are these 10 of them. Chattarimsha Uru, the thigh portions, there are 40. Dasha Vamshane, 10 in the inguinal area. Shatam Adhyaktam Eva Ekasmin Saktim Bhavati. So this way, 150 in Ekar, 1 Sakti is seen. Eten Ekar Sakti Bhavati Bhakyato. Shasti Katyam, 60 in the Kati area. पृष्ठे अशीतिः पार्श्वे षष्टिः उरसि त्रिंशत् षट्त्रिंशत् ग्रीवायां मूर्ति चतुस्त्रिंशत् एवं नमस्नायुष्टानि व्याख्यातानि. These are the 900 muscles of the body. Going into identifying these from the current nomenclature is virtually not possible, and I think it doesn't have any significance, so we will leave it as such. The muscles are classified further again by Sushruta. Now the classification of Vagpata we have referred to earlier. Now Sushruta has classified the snayu slightly in a different manner. Again, almost in the same way, snayu chaturvida vidyata tast sarvaha nibodhame pratanavatyah vrittascha prithviyascha shushirastata. Almost on the same lines like pratanavatyah, which have a tendon like or maybe rope like structure, long ones. Vrittaha, circular ones. Prithvyaha, wider, flat ones. Shushiraha, hollow, that's cover the hollow structures where there is a cavity. Now, Prathanamutya Shaka, so in the Shaka, in the limb, they are the long muscles which are presented there. Sarva Sandhishu Chapyata. Vrittastu Kandaraha, that Vritta are named as Kandara. Vritta Snayu is Kandara. Sarvaha Vijneha Kushaririha. Amapakvashayanteshu Bastauja Shushira Kalu. Shushira muscles, Shushira's tendons are snayus are present in the viscous of the body. Visceral muscles are considered as the Shushira muscles. That's absolutely justified. पार्श्व उरसि तथा पृष्ठे पृथुलाश्च शिरस्यता नौः यथा फलकास्तीर्णा बन्धनेः भूभिर्युता भारक्षमा भवेदप्सु नृत्ता समाहिता एवमेव शरीरेऽस्मिन् यावन्तः सन्धयः स्मृताः स्नायुभिः बहुभिः बद्धाः तेन भारसहाः नराः. The snayus are the structures which give that binding component or are the binding component of the joints, and because these joints are stabilized by these structures, body is capable of bearing the weight and strain. So stability of the joints is based upon the snayus. Now, when we count the structures now in the current method, we identify muscles, tendons, ligaments as separate issues. Sushruta might not have separated these issues. All that suspensory structures, they are considered as snayu, and among the snayu you have vritta, prithu, etc. And that kind of a perceptual difference has to be kept in mind when you go into these details. Nahi astini, namapeshya, nasira, nachasandhaya, vyapajita strahanihu, yatha snayu shariranam. The bones, damage to the bones, or the fleshy portions of the muscles, or the vessels, may not give the same harmful effects, the same morbidity as that of the suspensory structures of the ligament, joints, like the ligaments and tendons. Ligaments and tendons being injured would always have a poor prognosis than the muscle structures. Reason given by the current issue is the relatively poor vascularity of the tendons. Tendons do not heal, whereas the muscles would heal. Sushruta has considered, has not given that view. He has said that the complications produced due to the injury to the tendons is always more than what the muscles would have. Yasnayuh prabjanati bhashyascha abhyantarastata sagudham shalyam aharto deha shaknoti dehinam. The superficial and deeper groups of the muscles and tendons, they have to be studied properly if you have that surgical skill of reaching to each of the areas. The classification of the muscles, now of course I have referred to this issue earlier, again it's a repetition of the same. Now the classification is based upon the microscopic structures like cardiac muscles or the skeletal muscles and the smooth muscles depending upon the issue, and then the shapes also would be the same issue. This is repetition of what I have told earlier. Now Pancha Peshi Shatani, the Peshis are 500, and again their numbers are not very significant issues, so we will just casually read that. Tasam Chatvari Shatani Shakhasu Kosthe Shatshasti Grivam Patyurdam Chatushtrimshad Ekesam Padangulyam Tisraha Saha Panchadasha Dasha Prapade. Padopari Prapada is the portion of the heel which touches the floor in the beginning. पादोपरि कूर्च सन्निविष्टाः तावत्येव दश गुल्फतरयोः गुल्फजान्वन्तरे 20 पञ्चजाननि 20 ऊरौ 10 वंक्षणे 100 एवम् एकस्मिन् शक्ति भवन्ति एतेन इतरशक्तिबाहु च व्याख्यातौ पेशी are those the fleshy portions of the muscles which are counted separately compared to the spines. So that's all the difference. Otherwise, now from the current point of view, they are the integral structures. Now Sushruta has viewed them as a different entities. Now their counting number also is the same. So we'll not. It's not possible to make out exactly, pinpoint exactly like which are those structures and the current point of view and the other way. All that you have to have that vision of what Sushruta had identified by the gross appearance. Now hence शिरास्नायस्ति पर्वाणि सन्देश्च शरीराणां पेशीभिः संवृतान्यतः बलवन्ति भवन्त्यतः पेशी produce the covering and protect the joints and the other deeper structures of the body. स्त्रीणां तु 20 अधिक दश तासां स्तनयोः एकैकस्मिन् पञ्चपञ्चेति यवने तासां परिवृद्धिः अपत्यपदे चतस्रः तासां प्रसृते आभ्यन्तरते 2 मुखाश्रिते बाह्ये च वृत्ते द्वे गर्भचित्रसंशिलः 3 शुक्रार्तव प्रवेशिन्यः 3 एव पित्तपक्वाशयोः मध्ये गर्भशय्या तत्र गर्भस्तिष्ठति. The muscles of the breast, now Sushruta has used that term, the peshes in the breast. From the current point of view, you do not see any muscle structures in the breast. The breasts are considered as subcutaneous glands, but still there are the fibers, which the elastic fibers, collagen fibers, will give that separation, and Sushruta has considered them as a peshes. So, and that is all the difference. The nomenclature and the idea of this identification, the whole viewpoint is different in the current nomenclature and Sushruta's nomenclature. Sushruta has considered anything which is soft and elastic as the peshi as and hence the nomenclature of a peshes in the breast is considered, and which are related to the growth of the breast and the functions of the breast. Now we consider this as the ligaments and Cowper's ligaments, the name as Cowper's ligaments, and the collagen structures. We may not name them as the muscles. That's all the primary difference in the perception. And similarly, the musculatures are the elastic structures of the vagina and the uterus. They are counted as 30 as a tisra, 30 as a, which again from the current nomenclature you may not count to the same level. All that you may have that myometrium as a single entity, and then of course the pelvic floor muscles also would be, it will never come to that level of 30 from any method of counting now from the present point of view, and hence there is no question of equating them. Then tasam bahar pelava sthula anupratha hrusva dirgha sthira mrudu shlakshana karkasha bhavaha sandhyasti sudasnaya prachadakaha yatha pradesham swabhavat eva bhavanti. The quality of whether they are thick or thin or maybe wide of the fleshy portions of the muscles, it would vary according to the status of the body. Like when you say a muscular body, and you do the rigorous exercise, the portion which gives or which becomes prominent in a person who does the exercise, or a person who does not exercise, or maybe when there is an atrophy, these changes are seen in the fleshy portions of the muscle. These are the peshes. The peshes are those areas of the muscles which give or produce changes in the appearance depending upon the status of exercise or maybe the location of the body as such. So that gives the idea. Whereas now, when we know that it is the fleshy portions of the muscles which would have the atrophy or a dystrophy or so on, and the tendons are least affected by these factors. I don't say tendons are not affected, tendons are least affected. Now, when Sushruta says about the peshes are those areas which would have that different perceptions or different shapes and different consistencies based upon the status of the body by swabhava, by nature, this suggests about the same, the fleshy portions of the body. Same, pumsam peshyah purastadyah praptaha lakshana mushkarjaha strinam avritya tishtanti param antargatam hitaha. The peshes, the muscular structures of the male sex, they are considered to be directed towards the exterior, the penile and penile structures which are projected towards the exterior, whereas the similar structures of the female, they are directed towards the interior, antargatam. Marmasira Snayu Dhamani Srotasam Anyatra Pravibhaga. Marmasira Snayu would be discussed in a separate chapter later. Shankana Abhyakriti Yonihi Travarta Sa Prakitita. Tasyaha Trutiye to Avarte Garbhashaya Pratitita. Tatha Rohita Matsya Mukham Bhavati Rupadaha. Tat Santanam Tatha Rupam Garbhashayam Vidudbudaha. Probably during this discourse, there was a question by a student like how that Garbhashaya or the uterus has to be considered. Now, the shape of uterus and the yoni, the vagina. Sushruta has given that description as a Shankanabhyakriti yonihi. Yonihi, the vagina, is something like a Shankanabi, where there is a hollow structure which is projecting deep inside, and there are 3 layers according to Sushruta. Now, which are those 3 layers from the current point of view? Quite difficult to identify. Maybe depending upon the spasm or the tone of the muscles of vagina. Sushruta might have categorized that 3 steps of that projection. Of course, the tone of the vaginal vault can vary according to the status of the body and hence may not be a consistent entity. Anyway, that's about one issue. Then the shape of that cervix is considered to be like compared to the shape of the mouth of Rohita Matsya, one of the fish's mouth, that projecting point, that's absolutely justified. And these are the considered about the Garbhashaya. Adugno Amukashete Garbhe Garbho Garbhashaya Striyaha Sayonin Shirasayati Sobhavat Prasavam Prati. This is a point which you have referred to earlier, like in the previous chapters, like Garbha Kranti. The fetus would be lying in the uterus with the face towards the exterior. And Tasmat Nisamchen Janam Hatra Shalyasya Bachata. शोधयित्वा अमृतं सम्यक् द्रष्टव्यो अङ्गविनिश्चयः प्रत्यक्षतो हि यद्दृष्टं शास्त्रदृष्टं चेद्भवेत् समासतः तदुभयं भूयो ज्ञानविवर्धनं. To study the anatomy, you need to dissect the body. That process of the dissection of the body is not detailed in Sushruta, how to preserve the body, but in the commentary and in Vagbhata, that process is discussed in detail, like how the body has to be kept in water and flowing water and so on. And in the commentary, you get that description. The body has to be dissected, and then the structures have to be identified. But it's not only what you see directly from the eyes or maybe perceive from your perceptions, your perceiving organs. There has to be something which you have to depend upon the previous text also. Shastra Drishtam and Pratyaksha Drishtam. Something which you see directly as well as what you get the knowledge from the previous recorded knowledge, as well as something which is beyond this, but you can see as such. The method of description of or how to preserve the body and how to dissect the body mentioned by Sushruta is Tasmat Samasta Gatram Abhishophatam Adirga Vyadhipeditam Avarshaktikam Nisrasta Antrapurisham Purusham Avahantyam Apatayam Nibaddham Panjarastam Munja Valkala Kusha Shanadinam Anyatamena Avestita Angam Aprakashe Deshe Kothayata Samyak Pratichantam Dhrya Tato Deham Tartaratra the Kushira Bala Venu Balvaja Kurchana Manzamena Shani Shani Avagarshe Togabin Sarvanema Bahya Abdandaran Anga Pratyanga Visheshan Ethoktan Lakshayet Chakshusha. The how to preserve the body. Method of preservation of the body by Sushruta is the body should be of a healthy person which who has not suffered a long disease and who is not very old, like 100 years. And you have to remove the intestines of the body. First you have to open the abdomen and remove the intestines of that dead body. And then that body has to be kept in a panjar or a box-like structure in a flowing water and allowed it to be decayed. And that box has to be having munja balkala, that plant fibers to protect the body from getting damaged, but it should be decayed, partially decayed. So after 7 days in that, then you have to remove the structures, dissect the structures with a brush, not the scalpel. The method of preservation of the body now is totally different from what Sushruta has done. Quite naturally, during that kind of a method of preservation, lots of details would have been lost. You may not get the same details as we see now. Now we have that preservatives, and then the dissection method is totally different, and hence naturally the details which you get would be something more than that. But even with these efforts, whatever Sushruta has done, it has to be appreciated, and that depth of the knowledge of Sushruta has to be always kept as a guideline for us to do the further study. Now, whatever you see in your naked eyes, or whatever you perceive with your sensory organs, they are not complete. It's always you need to have something more than that, and that has to be based upon intensive training and your intellectual capacity. That's what exactly Sushruta says, and very very important shloka. न शक्यः चक्षुषा द्रष्टुं देहे सूक्ष्मतमो विभुः दृश्यते ज्ञानचक्षुर्भिः तपश्चक्षुर्भिः एव च. So simple naked eyes cannot see the life of the body. You can life of the human person. Like our Atma cannot be seen by naked eyes. For that you need to have jnana-chakshu or tapas-chakshu. Jnana-chakshu, the knowledge, and tapas-chakshu, effort. शरीरे चैव शास्त्रे च दृष्टार्थस्यां विचारः दृष्टश्रुताभ्यां सन्देहम् सन्देहम् अवापोह्य आचरेत् क्रियाः. You need to have a balanced view of, or balanced perception of what you see, drishta and shruta, whatever you have studied earlier. And this balanced view would give you a very clear idea, and that gives you the skill. With this we conclude Sushruta Samhitayam shareerasankhya vyakarana shareeram nama panchamadhyayah. If there are any questions, I will try to answer, and then we will conclude today. There are a few questions like, is the kurcha mentioned here different from the one mentioned in the pratyeka marma sharira? Yeah, that's true. That marma, that kurcha marma is something different, and kurcha mentioned in this context is different. We will come to that when we discuss about the marma chapter. Then that's it. Can we consider Seemanta to be somewhat similar to creases? Or no? Yeah, of course. Langer's line or creases, they are innumerable. They are not counted, and of course it's something comparable to the same. But according to Sushruta, their numbers are 14, whereas now when you say the Langer's line, they are innumerable. But maybe the practical importance of the Seemanta could be the same as that of the Langer's line, which gives that the elasticity, the direction of the elasticity of the superficial structures, and hence used in making the incision, the importance of the knowledge in making the incision. That's it. Right. Okay. Right. So we will conclude today. We will continue next week.